So the situation in the Western Trust in regards to COVID-19 and its impact on our services has changed very significantly in the last 2 weeks. On the 1st of October, there were 15 inpatients in our hospitals. Today, there are 51. Many of these people are extremely unwell. Fortunately, due to the skills of our staff and the advances in research since we first learned about COVID, the treatments that we're now using are quite effective. However, we continue to look after people who are seriously unwell. As a result, we've had to change our visiting policy in relation to Anne Kilgallen and stop all visiting with a small number of exceptions. We're taking this difficult step to protect our staff and our patients and clients, and we really appreciate the fact that people right across the West are working with us to try to protect all of us from COVID-19. One of the impacts of COVID-19 is on our staffing numbers. Right across the hospital sector, we have about 1 in 5 of our staff who are unavailable for work, largely due to COVID. In the community, it's not quite as bad. About 15% of our staff are affected, but this number is growing and it is really concerning for us as we struggle to maintain our services. I want to reassure you that our first priority is to continue to provide services for people who have time-critical need, and indeed for people who are very dependent on us for care, and in particular to support carers. And we've worked extensively to develop plans to maintain those services, but we are very challenged. One of the things I want to say to you today is to remind you to get your flu vaccination. We are very concerned that the combination of COVID-19 and flu circulating in our community could have a really serious effect on people's health. So please take your flu vaccine. We know our GPs locally have made a tremendous effort to make vaccine available to their patients, and vaccines also available through community pharmacy. And for our staff, it's available at various locations and through peer vaccinators in local teams. Please remember the basic rules that protect us all from COVID-19. Wash hands, observe cough etiquette, wear face coverings in public. For all our staff, wear face masks when providing direct care. And above all, please remember to observe 2 meters distance when in company with others. If you can't observe 2 meters distance, you should be wearing a face covering or a face mask if you're a member of staff and working in patient care. If you protect yourselves, you prevent the spread of the virus, and you protect your loved ones, you protect our patients and clients and their carers. Stay safe, take care of yourself, and we will all get through this together.